Hi, this is Dr. Greg Doerr. We're back for the second half of our podcast regarding pickleball. We're going to now take the second half of this and really dive a little bit more into the injuries that we're seeing associated with the sport, especially as it's growing exponentially. I mean, it's growing so fast. And as I've said before, we said in the first half, is like the age groups that are playing this sport are absolutely insane. It's no longer what this first started at as a elderly population, as almost like the tennis, but an easier tennis. Mm-hmm. It's the golf for the hand racket sport, but now it's everywhere. Like everybody's saying it. I mean, even in Long Beach Island, they literally closed down a department store on Route 72, and now they have the Pickler, which is a huge indoor pickleball place now. So it's just growing everywhere, and they're trying to find more and more courts. So what I would like to start addressing now, especially since it's hitting such a wide variety of age groups, is what are you guys seeing as injuries for those age groups? And then we can kind of go into discussing how we're going to manage them as you know, a certain age group versus another age group, a certain body part versus a different body part. And Michael, I know that we have time constraints with you today, especially for your job. So if you don't mind starting, what are you seeing associated with that? And take that from geriatric, you know, maybe that middle age athletic population, which isn't really middle age, and then going even to the youth population that you may be seeing with this.
Yeah. So I think the tennis and pickleball injuries as a collective whole are different. I mean, I've had my share from tennis, whether it's knee or shoulder, as you know.
Yep.
So I think for tennis elbow is something I still see or hear from players a lot, where they get the pain over here. And then I think the tennis injuries could vary from upper body to lower body. Tennis elbow and maybe shoulder pain being like up there as well. But for pickleball, I think it's more like lower half of your body, where it's your back because of the low bouncing ball and the awkward movements. And then ankles, knees, just because of the strain that particular movement is putting on some of those muscles if you're not doing it correctly. So I think the pickleball injuries tend to be, you know, from the waist down a little bit more, with it being back and knee and ankle. And tennis, I still hear a lot of people complaining about tennis elbow. So some of those like mainstay common injuries for tennis are more, you know, here and here, where I don't see that as much in pickleball. And I just think that's because of the equipment and the swing and the differences in the sports and the movements. So I would say for pickleball, you're dealing with more of, you know, back and lower body injuries versus tennis.
And are you seeing a variation in that off the age groups, or is that pretty consistent through?
I don't really, for pickleball at least, I don't really work with junior players, but I would say, yeah, I mean, I think those are the common things I hear from, let's say, you know, anywhere from 40s to however old people are playing pickleball. I think it's just a more common thing to have back, knee, and ankle. Obviously that's possible in tennis. I think, you know, a lot of it are possible, but I feel like maybe, you know, not specific to a confined age group. I think that I'm seeing, at least I hear more about those types of injuries in pickleball.
How do you address it with your people from the standpoint, and unfortunately a lot of these questions we're going to go to you right away too, but how do you address it when somebody starts either complaining the injury, or even you as a coach, you see when somebody's not moving properly?
Yeah, I think it's just judgment. I mean, if you're at a point where you're in excruciating pain or something is bothering you to the point, you have to, at least me as a coach, I'm not going to force somebody, but I have to remind them, like, you know, this is not life and death. Like, just take care of your body, like sit out if you need to, if you're not feeling great or something's bothering you, and just live another day and just try to see what's going on. You know, a lot of people just, when they step on the court, they just want to play no matter what, like, you know, you were saying. So I think it's just like listening to your body, and as a coach, I can kind of like, I think you should maybe like stop today, or I think you should sit out and see how it feels, and just try to take care of your body. I mean, that's what we've basically been saying in a roundabout way the entire time. So, yeah, I just think it varies person to person, case to case, but I just feel like, you know, don't try to be Superman. You know, you can figure it out and try to take care of your body first, and then worry about like getting back on the court, even though I know most people really want to, no matter what. You know, again, I'm not going to force people, but if I see somebody who's like struggling, obviously I'm going to try to recommend, I think you should try to take it easy, and, you know, maybe today is not the day. So, yeah.
Okay, so for me, I would say the population that I coach is probably that 35 and up. I have people that are playing that are 85 years old. It's kind of amazing. What I see, I also am seeing a lot of tennis elbow in pickleball, quite a lot of it. And that comes from overuse. As I said, people playing 4 hours a day. That's a lot. And 4 hours a day, and if your technique isn't proper, there are certain strokes where, like, I try to describe to people as we have like 3 levers in our arm. We have our shoulder, our elbow, and our wrist. There are certain shots in the game where all you're using is the shoulder, and I tell them, turn off the elbow, turn off the wrist. That's kind of my cue when I see them, because I'm seeing this going on, like the paddle's going up and down, and that's like a repetitive motion where it's supposed to be a motion that comes just from the shoulder. So that's one thing that when I see that, I try to correct that right away, because I know where that's going. Or if they're too wristy, sometimes, a lot of this is happening, and then before you know it, the wrist starts hurting. You're not supposed to be.
So it's cheats.
It's little cheats,
Yeah.
and it's not learning the proper technique. So they're using their body whichever way they can to get to that ball. So those are some of the cues that I will give to players, because I can sort of see something happening by the way they're hitting the ball. So we try really hard to correct them. That's why I get back to, invest some time, invest some dollars in learning the proper technique, because it does make a difference. As I alluded to earlier, I'm hearing and seeing complaints about Achilles. And that, I think, is a part of the body that a lot of people never warm up.
Yeah,
Is the calf muscles. I've seen calf muscles pop while somebody's sprinting, and that's also from their muscles are cold. And it could be, I've seen it in young people who are running for a ball, and next thing you know, they're stopping, and it's the calf. So,
Michael, any last comment on that
Yeah.
before I know I want to let you have a less stressful commute to your job. So is there any comment on that from the Achilles standpoint? Because I think that's a really hot topic right now, especially considering we just finished the basketball, even though it's a different sport, but we saw several Achilles ruptures that happened during the playoffs.
Yeah, I think if you have something that's bothering you, even in the surrounding area, going to the basketball with, Tyrese Halliburton's injury, then it's even more cause for concern with possibly damaging, like, your Achilles. Like, if you have a calf strain or you have pain like that's in the surrounding area, that's where I would say, like, really, even if it doesn't feel like it's, I don't know, super painful or serious, like, it could lead potentially, if not addressed, to something worse, like we just saw in the NBA Finals. So obviously maybe not to the same extent, but I think just listening to your body and just doing everything you can. I mean, there's no foolproof way to, like, 100% like
Never
prevent
guaranteed.
something.
Yeah,
Like,
it's never
being
guaranteed.
an athlete, like, you're just gonna have, whether it's tennis elbow or whatever it is, something is gonna come up at some point, unless you just stop playing, which I guess most people don't want to do that. But you're just trying to, like, realize, like, you're not a professional, so if you're in pain, you gotta stop. You gotta wait until you're right. You gotta try to also not assume that it's okay. You gotta try to see what's actually going on. If you're feeling something, you just go, I'll play through it, and then maybe you end up with something like, God forbid, your Achilles. So it's, again, all the stuff we've been saying: stretching, taking care of your body, staying hydrated too, because you never know. Like, if you're dehydrated and it leads to a cramp, and then it just trickles down. So I think, again, there's no foolproof way to prevent everything, but if you can just take it serious in terms of, like, listening to how you feel, then you're better prepared, at least.
Well, I want to say, first of all, thank you for coming. I know you got a busy schedule as well.
Sure.
So appreciate your time.
Yeah.
And we'll get right back into you and your descriptions in just a second. All right. No, you had already came back to the Achilles aspect, and you mentioned it. It was something I was going to bring up as a topic anyway. And largely, again, we saw 2 of the best players in the NBA just rupture their Achilles. Now, these are professional athletes. And in particular, in recent history, we've had 2 major athletes who were ignoring calf symptoms And the next thing you know, one bad step. Now, granted, one of our players in the finals was a fast, ballistic move. It was a quick step. He ruptured his Achilles. If I remember Kevin Durant's, which was a few years ago, it was a quick sidestep. It wasn't even like he was trying to accelerate. It was just this quick movement, and his popped on him as well. Please continue on with what you're talking with the Achilles, because I actually think not all injuries are created equal.
Okay. No, it's definitely, I mean, I was suffering with it myself. And as soon as I started to feel it, I was like, okay, I need to rest it. I need to figure out what's going on. So that's my immediate, is when something hurts, get it looked at. And for me, it was like the bursa. So icing, resting, and also I put inserts. That helped a lot. And stretching it more. Doing stretching and strengthening of like the whole foot. So that's helped a lot for me. But I am seeing a lot of people struggling with that calf and Achilles. And they just are playing through it. I don't understand it. Go get it looked at. So getting back to the stretching aspect of it, I think that's a part of the body that is neglected. So we'll stretch our hips out, we'll stretch our quads out. People will maybe do a little stretching of their hamstrings, but that part is neglected.
I'm going to go to you now. I kind of made the comment that not all injuries are made equally. We shouldn't address them all the same way, or for that matter, play through them all the same way. We've mentioned a lot of the body parts that are already getting injured, a lot of the areas that we're feeling symptoms in. Tell me the ones that you're saying, that's not the one you're supposed to be playing through. Like, give me the ones that you're saying to yourself, address these more significantly, whether it's a tennis elbow versus a wrist sprain, strain, versus the knee, Achilles, low back. Like, what are the ones that you look at and say, these are the ones, if they're lingering, I wouldn't play through, and you should be seeking help immediately?
Yeah, Achilles is definitely number one. I think when it comes to all the other injuries, such as a tennis elbow or a knee or back, if it's getting progressively worse as you're playing, that's a definite no. If it's staying a low level, it's not getting worse during or after your play, I think that you can continue cautiously if you're seeking help for them, not you're just playing through them. But yeah, Achilles would definitely be my number one.
And I'm going to comment on that myself, because I completely agree with Dr. Doyle. Like, if you think about the catastrophic aspect of an injury, and let's just take them to their worst case scenario. If you had an Achilles and it ruptures and you have to surgery on that, you're talking a year to a year and a half of recovery. If you have a low back injury and ends up being a disc herniation, and let's just say for one crazy reason we actually couldn't get it better, which that never happened, so we don't have to worry about that. Literally, you're talking about a surgery, and depending on the severity of that surgery, which there's so many different variations on that, again, you could be talking about months to years, if not on never playing again. Knees, okay. Patellar tendon being a serious one, if that one actually ruptures, that could again be a year and a half of recovery. Meniscal, not nearly as long. But I'm looking at those things going, same thing. If I see a tennis elbow, I'm going like, can you play through it? Is it progressive pain? Is it something that you're just dealing with? Shoulder, same thing. Is it progressive pain, or is it something you're dealing with? Wrist, is it something I can deal with? Because there's brace.
Radicular pain.
Yeah.
I wouldn't play through that.
Yeah, no question. I mean, if you're starting to get the nerve-oriented pain, that's a definite no. Shut that one down immediately. But looking at those, if I'm putting my hierarchy, the calf, as much as calf strain or pain, I'm going like, yeah, I can walk through it. I might even be able to run through it. But that's not when we rupture it. We usually rupture it on that quick ballistic movement, which no matter how small it may be or large it may be, that's what pops it. So to me, is if I can't self-manage my calf symptoms, stretching, eccentric loading, which we do in an exercise all the time of just slowly going from a toe-up position and slowly dropping the heel off the step. If doing that for a few weeks hasn't resolved it, then you need to address it. Because that's when you're going to see them pop it on the court. The second one to me would be low back. Is if you're getting low back pain and that's becoming progressive, it's one thing to have muscle spasm. Okay, we can take care of that. It tends to respond pretty quickly. But when it starts turning into the disc, you start getting nerve-oriented symptoms. those are ones that can now talk about months to years of recovery. And those are also ones that I would not screw around with. Like, okay, I'm doing a couple of my core exercises. The core exercises aren't getting rid of my pain. Don't wait. Like, those are ones address immediately. Tennis elbow and on other foots, like I look at almost every tendinopathy under the sun is, can you do negatives on them? Which basically means, like, if you're talking about a bicep, the bicep would be, this is the concentric or the contraction. The negative is slowly bringing it down against resistance. If you can do negatives with almost any tendon in the body, it should get better. If it's not, that's an addressing. Like, you should address those pretty much immediately. Tell me what you're seeing mentality-wise regarding the injuries. Because there's always the physical, but then there's always the mental aspect of the injury, whether it's coming back or I'm trying to play through. Why don't you go with the I'm trying to play through it first? What are you seeing with those age groups? And again, if you want to break it up into your different populations,
Okay.
feel free.
Okay, so everybody wants to get back on the court after an injury. I think the real question is, at what point in time does a person realize I need to see someone? When it's so painful that they can't play anymore, that they can't step foot on the court, they're waiting that long? Or is it, this doesn't feel right, you know, this has been lingering for a couple of weeks, maybe I need to get this looked at. I think that's something that is not always addressed properly. People just realizing, like, so, like, I'm asking you, when is that? At what point is, if my Achilles is bothering me, at what point do I say, I need to go get this looked at?
I'm going to let you answer first, and then I'll
Yeah.
just give my classic adaptive progressive.
I'm probably not supposed to be asking the
No, no.
questions, but, you know,
Yeah, again, if they're doing an eccentric exercise on their own to try to get better on their own and it's not improving at all, or if you've noticed a week or two goes by, again, not improving, even though the sooner you come in for an injury, the sooner you will get better. But again, if there's no improvement as time goes on and now we're getting progressively worse as we're exercising, then you definitely need to get it checked out.
Yeah, my rule of thumb for almost every activity has always been adaptive pain versus progressive pain. Anytime somebody starts an exercise, I don't care if it's just in the gym or whether it's actually sport oriented, if you're getting adaptive pain, that means something hurts when I did it. Well, a lot of the time that's training. In other words, you're using muscles you never did before, so you're going to feel symptoms, but it should become adaptive, meaning the more and more I do it, the less and less it becomes.
exactly.
Progressive pain to me is immediately an injury. Now, can you manage it on your own like Dr. Doyle is talking about, or do I need to seek attention? My rule of thumb is, look, if you stub a toe, I don't want you calling my office to come in because you stubbed your toe. But legitimately, if in 4 days to a week, if you're consistently getting progressive pain, that's an injury cycle. And even if you're self-caring, within a week you should start noticing symptoms are getting somewhat better.
Right.
Doesn't have to completely get better, but somewhat better. Okay, you're getting better, give it 2 weeks. If it's not better after 2 weeks and you're staying very close to the same, that's give a call immediately. However, people who are athletes, people who want to be in competition, people who realize and know their bodies well enough are going like, yeah, I might be doing what I need for myself and it might be a little bit better, but it's not really better. Those people tend to be smarter and call pretty quickly knowing that I'm going to end up in an injury cycle. To me, again, it goes to body parts. We have braces out the wazoo for elbows. Now that doesn't mean you healed it, but you can play through it. There's tendons that are more prone to tearing than other ones. You don't want to tear a patellar tendon, a knee tendon, or the quad tendon. You don't want to tear an Achilles. Have we taken care of people who have torn tennis elbow, lateral, extensor tendon? Yeah, we've seen that. Honestly, and most times, I usually see that surgery is usually a result of mechanics somewhere else. In other words, the shoulder's not functioning properly or the wrist's not functioning properly, and all the forces keep going to the elbow. But the elbow is less likely to tear and less likely to have a significant tear than a knee or an Achilles. So again, I'm looking at those injuries as what's more important to me. I want to get to the ones that are more critical first. Back is definite. Like the back to me, there are so many different variations on what create back pain. Could be muscular. Well, the great thing about muscle pain is it tends to go away quickly. And if you stabilize yourself, you're able to get back into sport very quickly. If it starts becoming discogenic, look, most disc injuries, this is a classic thing that we say in our office all the time, a disc injury, 4 to 12 weeks is a very, very good clinical span of how long it takes to heal one. 12 weeks is somebody who's in really bad shape. Screaming pain down the leg, bad tingling numbness, things along those lines. Gets worse with classic things like sitting, morning pain, bending forward, lifting, squatting with weight. All of those things tend to generate disc pressure and would give you more pain. So if you're having people that are coming into you going like, well, I've got leg pain, but it only happens to me when I do this, does it fit any of those things? Mm-hmm. Sitting's usually worse, morning's usually worse, lifting or decompressing when you're talking about squatting or lunging with weight, those things will tend to irritate it. If those are happening, driving, then those are things that you should address immediately. Mm-hmm. And quite frankly, we could say go see the orthopedist. Obviously, we're chiropractors, so the orthopedist, you could wait 6 weeks to get into safe.
Right.
For the most part, Dr. Doyle and I, like literally, even if our schedule was completely filled, and it was somebody that said, hey, Giovanna sent us over, I can promise you they'd probably be in at lunch, after hours, or before hours in the blink of a second. But we're also not in the mind of when somebody calls up and says it's an emergency, we rarely let somebody go more than 24 hours before they're getting into our office to begin with. Mm-hmm. And again, we're willing to actually sacrifice some of our administrative time or personal time to make sure somebody gets care. That's just the way we've always run our office. We actually care about people, so it tends to be how we work. And at that same moment, I want people to be independent. I want them to know how to take care of themselves. And I know from that standpoint, one of the things that Dr. Doyle and I are currently working on with Kayla, who's basically been running a lot of our social media and the podcasts themselves, she's the one who's the brainchild behind all of this, is setting up things on our Instagram page like, hey, you got a tennis elbow, try and do these exercises, you got this. So at least you have direction too. And I think that's one of the challenges. Most people are getting most of their information on YouTube, except you have no idea who that person is. Mm-hmm. You have no clue what their training is. And 90% of the time, the stuff that I see on YouTube, I'm like, oh God, no. Please don't do that, ever. Let's go into that. How many of your people are actually getting, whether it be their medical advice and or their direction on how to play from social media and or digital references?
I would say a lot of people. I've had people say, oh, I watched a YouTube video on how to play. Okay? I mean, it's out there. It's all over. I mean, there is some good quality, maybe not on YouTube, but I have seen some really good Instagram sites where there is good information. There is good information, but there's nothing like the one-on-one. There's nothing on having somebody's hands on you and looking at what's going on in your body. You mentioned something earlier, which I think ties into, you mentioned like emotionally and mentally. Yes. So I think one of the biggest reasons why so many, I don't want to just say seniors, because I'm seeing more and more of like that younger crowd getting involved. So like at my club, we do a lot of social events. We're an academy. We are very serious about instruction. And I'm really happy to be a part of that because that means a lot to me, to teach people the proper way to play, the proper way to use their bodies. We really focus on that. But we do have a lot of social events. Why? Because people are craving that. So many people get involved in this sport for the social event. Everybody's playing. Yeah. What am I missing? I got to get involved. So they get involved. And then they love the social aspect of it. Look, that's how I got thrown into it because I was coaching at a tennis club and there was a group of people playing pickleball and the owner of the club said they need another player. I was like, well, I don't play pickleball. I play tennis. I'm a tennis player. And he was like, I don't care. We need a body. Just go in there, play tennis. Just do whatever you have to do, hit the ball. So I went out there and it was like a 4.0 plus level advanced play. I jumped in. I had the best time. 2 hours with this group and I was hooked. I took my paddle and went down to the local park. I sat on the bench. I got invited to play and there I was playing. So the social aspect of it was very exciting to me, because with tennis, it's got to be a little bit more organized. You have to play with people that are close to your level.
Keep going.
You're good.
You have to play with people that are close to your level to get something out of it. With pickleball, beginners can play with more intermediate players and still have fun. So what I see a lot of people getting involved to meet new people. Sometimes I'll come down to the park and I'll see a group of like 80-year-old men, 7 o'clock in the morning, playing pickleball, and I just think to myself, what would they be doing if they weren't playing pickleball?
Watching TV
They'd probably
or
be
sleeping.
watching TV or sleeping.
Yeah.
Exactly. So there's that aspect of it. Nobody wants to be out of the game. So they get hurt, they get injured, I got to get back. And so they self-medicate, by taking Advil or Aleve, maybe doing a couple of stretches, wrapping their knees up. Sometimes they come in with like 2 knee wraps, an ankle brace, elbows, everything, to get back in the game, because not so much because they miss just playing, they miss the social aspect of playing.
I'm sorry, I have to comment on something just, and then I'll send this to you for a second, but I think of 3 patients right now, in particular, at different age groups. And the mental aspect of pickleball is very interesting, and it's different for all 3 age groups. The younger age group, which is a guy who's in his mid to late 30s. And his aspect was, it's social, it's fun, I get to talk to people, I have a good time, and it's also networking. The 50-year-old group was, this is my way of staying in shape and I'm making friends associated with it. So I want to keep playing because I feel like I'm staying in shape and I'm meeting people and I'm making new friends. The elderly, or that geriatric population, she was over 70. It was, I have to get back. This is where I hang out with people. Like, it's interesting that the emotional attachment increased drastically as they were getting older, whereas the younger population, again, and a lot of more of the, like, if you looked at me going through my years of playing the sport that I played competitively, which was soccer, when I was in my 30s, it was about, like, I want to be an athlete still. When I was in my late 30s, it was about hanging out with the guys afterwards, going getting a lunch and having a beer. And when I got into my 40s, it was like, can I still be an athlete? And should I still play this? And I even saw that as an individual, my change in mentality on my sport. But it was very interesting how those 3 populations looked at it emotionally very differently. Even though same sport, same type of activity, but their emotional connection to it was very different. And I'm sorry, I'll throw that over to you now after I've probably said everything under the sun that you would have said.
Yeah, I agree. I think I have seen a lot of improvement with the recently retired population, because I think they lost their routine. They're falling into more depressive symptoms. Some of them get involved in pickleball and then they get that social aspect back. So it is really great seeing them, have that joy again in life. But again, a lot of them have not exercised throughout their entire life. So you do see them coming back in with injuries, but I do like the social aspect of it with them.
And even going into that aspect of the age population is, Michael and you have mentioned about back knee. It's interesting that what I've seen, again, as they were aging, is I'm seeing more of that lower extremity. Some of the younger population are still trying to swing as if it's a tennis racket, or so they're still swinging really hard with that, and you're seeing a lot. I've seen more of that upper extremity because they're trying to play pickleball like tennis. And again, that goes to, they don't understand the game yet. They don't know the game. They don't know the intricacies of it. They're still trying to be the young athlete that I can overpower somebody. Piggyback on that.
So there's that feel good, that feeling you get when you smack that ball. It's something that it's just a real feel good thing. I mean, I never played soccer, so I don't know if you get that from kicking a ball really hard. I'm sure you get it when you dunk a basket.
Volleyball.
But there is something. It's like punching somebody. It's just, and I see a lot of that overswinging, overhitting, people loving to hit the ball. As a matter of fact, when we teach The initial part of our lessons is the soft part of the game. That's how we get people really warmed up, and the soft part of the game happens in the short part of the court, that kitchen area. We're 10 feet apart from each other, or 14, whatever it is. And it's a soft game. And people struggle with that, because what they really want to do is, they want to swing.
They want to clobber it.
They want to clobber it. You know, keep the paddle out in front of you, because the game is soft. You know, I'll demonstrate. It's like tossing a ball. That's really all it is. You're just tossing a ball, except now you have a racket in your hand and you're pushing that ball. That's the motion. It's pretty simple. You really shouldn't get hurt doing it. But what happens is, paddle comes back here and they start like, where are you swinging to? You only have to get the ball like 5 feet in front of you. That's it. But there's that feel good. They can't wait to hit the ball hard. And it's actually easier to hit the ball hard than it is to hit the ball soft. To have that control takes discipline. So they get to that back of the court, and I don't care what age they are, they cannot wait to get that ball and smack it as hard as they can. It's uncanny. And so that's where I think also that wild swinging, definitely shoulder, elbow, wrist, without proper technique.
Yeah, that's interesting that you're bringing that. I mean, you both brought up the injuries that you see most often, but it's interesting that that's kind of what I've seen. Is that I see a lot more of the upper extremity injuries in the younger population, and a lot more of the lower extremity back injuries as they're getting older because of mobility, flexibility, and deconditioning.
Exactly.
And it really comes down to, like, look, in our office we treat almost all tendons. I don't want to say the same. They all have their own little nuances. But if you can do soft tissue work, if you can eccentrically load it, and if you can tape it, most tendon injuries are going to respond pretty well. Back injuries, again, especially if it's discogenic, we do so many different things between McKenzie and traction. If it's more muscular, again, soft tissue, lunging aspects with the SI joint, and all of those have their own little nuances. It comes down to really somebody who can actually diagnose the difference between one or the other, and actually, not everybody gets the same treatment, which, again, is unique. In our offices, we don't treat every injury exactly the same, depending on if it's the same injury with 3 different people. It could be getting different treatments. But it seems like no matter what we've talked about, it comes down to 2 major things. Number one, from the side on you, it's, do you actually know how to play the game? Have you been properly instructed on how to play the game? And if you're getting sources digitally, which a lot of people do nowadays, is that at least a reputable source? Not some guy on YouTube or girl on YouTube has decided to show you how awesome they are. Because most of digital media is shock and awe. Is they're trying to impress, and that's how they get you in. Within the treatment aspect, knowing somebody who diagnoses, understanding how to take care of the different injuries between tendon, soft tissue, disc, joint, sprains, as you were saying, with ankles, with lateral movements, and being able to handle those. So I think from that standpoint, you get a great marriage between instruction and treatment, is if you actually get people who understand the sport, understand what they're doing, and then can keep you in the sport, especially since we've talked so much about the emotional component and how important it is for people. So I will close up once again from Bergen Chiropractic Sports Rehabilitation Center. Dr. Doyle and myself, Giovanna, thank you so much for being here and being an expert for us. Appreciate you guys sitting through and listening to us again. With any luck, we'll see you next month and our next podcast.